My name is Rachel Hines. Today we'll be reviewing contact tracing in schools. We'll go over information about COVID-19, how to identify students and staff with COVID-19, how to do contact tracing in a school setting, how to notify parents and communicate to the health department when you have a case, and when to readmit students and staff. First, it's important to understand some basic information about COVID-19. The pathogen that causes COVID-19 is the SARS-CoV-2 virus, and the primary mode of transmission is person-to-person through respiratory droplets. This means that most of the time when people are getting sick with COVID, it's because they were in close contact with another person who had COVID. The best way to prevent COVID is through masks, barriers, and social distancing, just as many of you have heard through the media through the last few months. Two of the numbers I'd like to highlight with COVID-19 that are crucial to contact tracing and knowing when to readmit people are the incubation period and the infectious period for this virus. The incubation period for COVID is 14 days. This means that once you are exposed to someone with COVID, you can develop COVID-like symptoms and COVID disease anytime in the 14 days after this exposure. The infectious period is the time period when someone who has COVID is infectious and can spread the disease. You can begin spreading COVID 2 days prior to the start of symptoms. That's why this disease spreads so rapidly. It's because you can be infectious with this 2 days before you ever know you're sick. That infectious period then extends from onset of illness, that first day where symptoms appear, for the next 10 days. Two of the technical terms for COVID that are interchanged a lot in the media are isolation and quarantine. So I'd like to review the public health definitions for these so that you know when we reference isolation or quarantine, you understand what we're referring to. Isolation is when you take someone who is sick with COVID-19 and you separate them away from people who are not sick so that you break the chain of transmission and don't spread the infection to people who are not sick. Quarantine is when you take someone who is healthy, who does not have COVID-19, and you separate them so that if they develop disease, they don't spread that infection to someone else. Our expectations for anyone who is in isolation or in quarantine for COVID-19 are that they stay home, that they use a separate bedroom and bathroom as much as possible, that they separate from other people as much as possible, and that they do not go to work, school, sports, or to other public areas. When we're identifying students and staff with COVID-19, there are two ways you will generally learn about one of these cases. The first method is through self-report of a positive test. That's when a family member or a staff member calls and says, "Hey, I tested positive for COVID-19." When someone says they have a positive test, it's important to understand the different types of COVID-19 testing available so you understand which tests need to have an action taken. There are 3 types of COVID testing available in the community right now. The first type of test is the PCR test. That's the nasopharyngeal swab where they swab your nose and they go way back. And that is a test that looks for COVID DNA. That is our gold standard and is our most accurate test for COVID-19. If someone has a positive PCR test, those are the most common in our community, and those are the ones where we're going to be reacting and quarantining and isolating people. The second type of test is an antigen test. These are the rapid tests that are available at a few sites within our community. This is the test where they just swab your nostril and then you have a result 20 to 30 minutes later. These are the second most accurate type of COVID tests available right now. The third type of testing available in the community are antibody tests. These are not a nasal swab. These are a blood test that looks for an immune reaction to COVID-19. These are not currently very accurate, and we do not follow up with antibody tests. If you have a staff member or a student that has a positive antibody test, you do not need to do anything with that test. The next method of identifying staff and students with COVID-19 in your school is with a positive symptom screen. To the right here, you have the symptom screen document that is up on our Douglas County Health Department website. This is built to help you screen students and determine when they need to go home and what needs to happen. If you screen a student or a staff member and they meet the criteria in the yellow box, so that is a student with 2 or more of the following: fever, chills, rigors, muscle aches, headache, sore throat, nausea, vomiting, diarrhea, or at least one of the following: a new cough, shortness of breath, difficulty breathing, new loss of taste or smell, or if they have at least one symptom and there's someone in their household who is currently in quarantine or positive for COVID-19, that is considered a positive screen for COVID-19. That is someone who needs to be sent home immediately. If they go and get tested and test positive, they need to be excluded from school for 10 days from when their symptom first started, and they need to be at least 24 hours fever-free without the use of fever-reducing medications, and their symptoms have to improve. When all three of those criteria have been met, that student or faculty or staff can return to school. If that student or staff is sent home and not tested, assume they have COVID and keep them out for 10 days from when those symptoms started. If that person who screened positive for COVID symptoms goes and gets tested and their test is negative, they can then return to school as long as it's been at least 24 hours without fever. Moving on to contact tracing. The goal of contact tracing is to stop the chain of transmission. We know that this virus spreads rapidly from person to person. So if we can identify that person who is sick and then identify the people who are at risk of being infected with COVID-19 and keep those people at home, then if those people become sick, they don't spread that infection to other classmates and other staff. When we're talking about close contact in this context, we're using the definition of within 6 feet for 15 minutes or more, and it's a cumulative 15 minutes. When we are contact tracing, there are 3 steps you can follow to figure out who is at risk of having COVID-19 and who needs to be sent home. The first step is to determine your infectious period. At the beginning of this, we discussed that you are infectious with COVID beginning 2 days before your onset of symptoms and continuing 10 days after that onset of symptoms. If you can identify when that student or faculty member had onset of symptoms, now you can look at what days were they at school while they were infectious, and that will narrow down the number of days that you have to look at during your investigation. Next, determine where that student or staff member goes during the day. Some questions to think about: how do they get to school? Are they on a bus? Do they carpool with other students? Do they walk with a group of other students? What does their class schedule look like? Are they involved in any sports or extracurriculars? Do they have a friend group at school that they spend time with, maybe in other classrooms? And do they have siblings in the school? Next, for each of these exposures, for the bus, for classes, for sports, look at who was in close contact with that positive person. So look at who was within 6 feet for 15 minutes or more, and that's a cumulative 15 minutes for each of those activities. And we'll go through some examples here. So here's an example of a classroom where you have a positive student. It's a stationary classroom, so the class stays in this classroom and doesn't move. In this situation, the desks are 6 feet apart, so you don't have anyone within that 6 feet, 15-minute close contact criteria. So in this example classroom, no one would need to be sent home. Obviously, you would still have to take into account where's the teacher, sports, extracurriculars, and other times. But in this graphic here, at least, no one would need to be quarantined. Next, we have a classroom where you have a positive student. Again, stationary classroom, so the students stay in one class, but the desks are less than 6 feet apart. So you can see the positive student in red, and then in the orange boxes, you can see the students that meet that close contact definition, that are within 6 feet of that positive student for 15 minutes or more. Now, it would change a little bit if that student is on the edge of the classroom. This is the same situation as before, just a different desk position. Here you can see that if you have a positive student, but the student travels to multiple classrooms, say in a high school situation where the student goes to math, English, history, and science, all in different classrooms, you can see how many more students are now exposed. These are all desks that are less than 6 feet apart, and you can see how that number of students that now need a quarantine increases. Let's look now at positive teachers. This is a situation where the teacher is positive, and you can see in the image that there is less than 6 feet between where that teacher walks to present during the day and that first row of students. So if you have a positive teacher, you need to take into account which classrooms are they in? Are they in one classroom or multiple? And where do they go? If a teacher just stays at the front of the classroom and doesn't walk throughout the classroom, you might only have this first row of students exposed. Here you can see for that same situation, if you have a teacher that stays at the front of the room but travels to multiple classrooms, say a specials teacher, you can see how many more students would be exposed when you take into account the other classrooms. Here's a situation where you have a positive teacher in one classroom, but that teacher moves throughout the classroom. Say, this is a kindergarten teacher who has to help students students with holding a pencil and with phonics and requires some of that close contact and moving throughout the classroom. You can see in this situation, if the teacher is positive, you might have a whole classroom exposed. And again, that same situation expanded out to multiple classrooms. It's important to note that if you have one case in a classroom, this contact tracing method of identifying close contacts, of identifying all the students within 6 feet for 15 minutes or more, might be effective to help contain the virus. If there is a situation where there are 2 positive cases within one classroom, whether that's a student and a teacher, or 2 students, or a teacher and a para, whatever combination that is, that might be evidence of COVID transmission within a classroom. If you have 2 positive cases within one classroom or one activity, say one sports team, please reach out to us at Douglas County Health Department directly to help you deal with that situation. When we were walking through all the examples previously, we looked specifically at the classroom setting. However, we know that students aren't always isolated to one classroom throughout the day. Other areas to consider when contact tracing are the lunchroom. Are all the students in a big cafeteria together? Are they in close contact with different groups during that lunch? Are students just with their classroom during recess, or do they intermix with other classrooms during recess? Are classrooms stationary, or is there travel between classrooms? Sports and extracurriculars. This same contact tracing scenario and method can be applied to things like sports and extracurriculars. So if you have a sports team with a positive individual, we do the same sort of thing. So look at during the sports game or the sports practice, who were the students within 6 feet for 15 minutes or more. We get a lot of questions about masked versus unmasked for contact tracing. A lot of people ask, if I'm wearing a mask during the exposure, do I still need to quarantine? Here at Douglas County, we do request that everyone that was within 6 feet for 15 minutes or more quarantine, even if they were wearing a mask. And the reason for that is we know that not everyone wears a mask correctly. And it's not worth the risk if someone is wearing their mask wrong or took off their mask, or if you have little kids playing with a mask, to not quarantine and then have an outbreak of COVID within a school setting. So even if everyone was masked, we still ask that they quarantine. The mask still is a great idea. The mask will cut down on the number of people quarantined that end up actually getting COVID-19, which is great, but it will not cut down on the number of people who need to be quarantined. Once close contacts of a positive case are identified, the next step is to notify staff and parents of the exposure. Here on the right, you can see a template letter that we have developed. This will be up on our Douglas County Health Department website under the school reopening section. You can use this letter and put your own letterhead on the top, and you can dual brand it. We've left our logo on as well. It's a letter that we've already approved that can be used to notify people that they were exposed to someone with COVID-19, and it explains the quarantine recommendations. We ask that if you change anything on this letter, you take our logo off since it has not been approved for us. This letter explains that anyone that was exposed to someone with COVID-19 needs to quarantine at home for 14 days from the last day of exposure. So if a classroom was last exposed to COVID-19 on September 2nd, those students will need to quarantine for 14 days through September 16th and can return to school on the 17th. It is important to note that anyone sent home to quarantine for 14 days cannot be readmitted early, even if they test negative. This is stated in our letter at the bottom as well. A negative test does not mean your child is able to return to school or participate in other group activities before the final date of quarantine. The reason for this goes back to that incubation period we discussed at the beginning. We know once you're exposed to COVID-19, you can develop signs and symptoms anytime in the next 14 days. If you get tested on day 2 and get a negative test, you might still develop signs and symptoms of COVID-19 on day 8 or 9. We would hate to readmit people to the school setting and then have them develop symptoms, resulting in more students being sent home. Once we've notified staff and parents, the next step is to notify us at the health department. We will have a reporting link posted on our Douglas County Health Department website to a survey system called REDCap. If you click the link on that Douglas County website, It will open a survey similar to the one on the right. This is still in draft format, so it might not be exactly the same. We'll have you enter reporter contact information so that we can reach out to you and help you through this process. We'll have you enter information about the person who tested positive, so their name, date of birth, when they tested positive, and if they're a student, teacher, staff. And then we'll have you enter information on close contacts that will be quarantined. Next, let's discuss when to readmit people to school. We talked a little bit at the beginning about when to readmit someone who is symptomatic. Someone who tests positive for COVID-19 needs to be out for 10 days from when their symptoms started. So if their symptoms start on August 1st, they need to be home through August 11th and can return to school on August 12th. Testing in our community for children and those under 18, especially younger children, is limited. So what you might see instead of a positive test is a clinical diagnosis. You might get a doctor's note or a doctor's report saying that, yes, this person has COVID-19, but there is no test result showing that they have COVID-19. In that case, where there's a clinical diagnosis of COVID, that student or staff member needs to stay out for 10 days from when their symptoms started. If you have someone who is asymptomatic but tests positive, so that means they've never had any symptoms consistent with COVID-19, but they have tested positive for the virus, we start counting that 10 days from the day they were tested. So if they were tested on August 10th, they need to quarantine through August 20th and can be readmitted on August 21st. Next, let's discuss when to readmit someone who is exposed to COVID-19. So you've identified that you have a positive, you've gone through and found the close contacts. Now, when can those close contacts return to school? Close contacts that are not related, so no family members, they're not siblings, parents, this will be like other classmates or other teachers in the school. Next, let's discuss when to readmit someone who is exposed to COVID-19. You've identified that there's a positive, you've identified who those close contacts were that were around the positive person, and you've sent them home. Those close contacts that you've identified can return after 14 days from the last date of exposure. If you have a student that tests positive on August 1st and you've identified close contacts in that classroom and sent them home, those close contacts can return 14 days later, so they need to quarantine through August 15th and can return on the 16th as long as they're not having any symptoms. If someone is sent home to quarantine and then develops symptoms consistent with COVID-19, then you go back to your symptom criteria and you quarantine for 10 days from when their symptoms started. However, if you have students who go through the whole 14 days and have never developed symptoms, then they can be readmitted after that 14 days. And we have a visual on the right that is also available on the Douglas County website that can help you navigate those decisions. This does get a little more complicated when you're talking about household members. So if you have a student who is positive and has been sent home and they have other siblings in the household who also go to the same school, those siblings do need to be sent home even if they're not in the same classroom because they're probably in close contact with their sibling outside of school at home. There are two different rules for when household members can be readmitted that are in contact with a positive case. So if you have a positive member in a household, but everyone in that household is able to isolate perfectly, so everyone is in a separate bedroom, separate bathroom, no intermingling within the family, then family members who are asymptomatic can isolate for just 14 days from the first day they started isolating within that house. Now, we know that most of the time this isn't realistic. A lot of the times you're going to have young students who aren't going to be able to isolate in a room because they're young and they need a parent caring for them, or maybe there are shared bedrooms, or maybe you have a teacher that is going home to care for a sick child. In those situations where that perfect isolation can't be maintained, those individuals need to isolate at home for the entire infectious period of the positive person. So that's a minimum of 10 days, and then they have to isolate for an additional 14 days after that. So that's a minimum of 24 days from when the positive person's symptoms started. We realize that's a really long period of time to isolate at home, but that's important to make sure that we don't have transmission within a school. The reason for the 24 days goes back to that infectious period and incubation period. If you have a positive person in the household and household members are intermixing, we know that positive person is infectious for 10 days once their symptoms start. So they are constantly exposing their family members for the entire 10 days they are infectious. After those 10 days, that positive is no longer infectious, but then the incubation period starts. So that's why you get that additional 14 days. The family members that aren't currently sick in the household have been exposed for 10 days, and now they have an additional 14 days where the virus might develop. So they need to stay home for that 24-day minimum. And if you have questions about this, please just reach out to us at the health department and we can help you make that determination. Thank you.